Good afternoon, everyone. Thanks for joining us. My name is Teresa Freed. I'm the Assistant Director of Public Affairs and Communications for Johnson County Government. We have with us Dr. Sami Ariola, Director of the Johnson County Department of Health and Environment, and Elizabeth Holshoe, JCDHE Epidemiology Director, and Allison providing ASL for us today. Thank you all for being here. Well, first off, can we talk about today's clinic and just the focus for next week's vaccinations?
Thank you, Teresa, and good afternoon, everyone. Our clinic went pretty well today. We vaccinated 1,566 of our residents. Many are second doses, some are first dose. And yesterday we did about 1,700. So this week's been pretty successful in terms of vaccinations. We feel like we've almost caught up. There could be some of you that couldn't make your second dose appointment, but thus far, everyone that's due their appointment should have had the opportunity to do that. Now, there could be some who needs a Moderna dose who was not able to make our clinic last week. There will be additional opportunities coming up to do that. But the clinics ran pretty well. It's also the week before we begin to move to our new location that next week. Haven't said all that. There are some that are due their second doses next week and are going to get their second doses at Oakland Fieldhouse. So if you got vaccinated 3 weeks ago at Oakland Fieldhouse and you are told to show up to the same location at the same time, we will be there waiting to vaccinate you next week. Tuesday through Thursday, I believe, is the setting for Oakland next week. Now, our clinics at the new Lenexa location, which is 15500 West 1/8th Street in Lenexa, opens next week. And we opened up our appointments for those yesterday. And those appointments were filled pretty quickly. That's what I had happened. Really, most were taken within the first 30 minutes that we opened them up. Obviously, the first day, we are kind of taking it slow to make sure that we fine-tune the flow and the processes, and then we ramp up as we go through the rest of the week. And so please do not show up if you don't have an appointment, basically just sharing the information for awareness sake. Those that are coming in will have their appointment. They will know when to show up. They will know what day to show up. And so we're very excited about that. Moving forward, this facility does give us a lot of flexibility. We are going to be looking for opportunities to vaccinate for longer hours. We're going to be looking for opportunities to vaccinate after hours. Right now, to come to our clinic, it's during the day, and if you're working 8 to 5, you are at a disadvantage. We are also going to be looking at vaccinating on the weekend, Saturdays to be more precise. So those details, we will be unveiling those details next week as we finalize the arrangements. Logistically, this is very helpful. We don't have to assemble every morning. We don't have to disassemble every morning. For every 4 hours of clinic that you see us do, there's several hours and several efforts behind the scene that go into making this work very well. And now I'll give a couple of examples. People in 4 hours, sometimes we are giving out 1,700 doses. We've done more than that in some cases. And if you look at some of the quote unquote mass vaccination clinics that are running several hours a day, many don't even have that level of output, or slightly more than that. For clinics that run for 4 hours, even though we do ours several times a week, which again is part of how that works, it's a very, very highly efficient process. The more reason why you can't show up if you don't have an appointment, because if you do, you'll be disrupting the process. We're maxing out the resources that we have. They're very well planned and calculated per 30 minutes for who shows up, and even with better granularity than that, but just roughly how many people comes every 30 minutes. So disruptions are not helpful to the process. So if you don't have an appointment, don't show up. But that's the plan for next week. We are very happy that we have this new location, and it will allow us to do more. In addition to our clinics, we do want our residents to know the several activities that are going on. I am talking about the appointments that the Department of Health and Environment has planned for next week, but our partners, our health systems and other partners are also vaccinating. We're vaccinating in phase 2, and we're beginning to allow appointments for phases 3 and 4. It's not just us. So I've talked about the appointments that we opened up, but our partners are Olathe Health, Advent Health, KU Med, Menorah, St. Luke's. All of them have appointments that are also vaccinating Johnson County residents in these phases also. These health systems also are they're vaccinating our residents that are in higher age. We have programs where we are moving resources that are vaccinating large employers. We are going to be vaccinating Amazon the first week of April. We are providing the vaccine. They work with a third-party entity to do that. We are through partnership with KDHE, we were sent vaccines to vaccinate Tyson Foods workers here. And so all of those pockets are going on. We've got Vital Core, who provides health services to our correctional facilities that are vaccinating in those groups. And then we have several of our health systems with targeted vaccinations to our minority populations. Advent Health has been vaccinating our Latino and African American communities, and they're having programs that we are working to get settled, to go to churches and into those locations to vaccinate people where they are. We had a clinic yesterday that was the transportation clinic, working with our transit authority that helped us. And look, hopefully next week we share some of the very nice pictures that we have of people that we went to their homes, picked them up, brought them, got them vaccinated and took them back. And we also have a program where we have 2 teams that are going around to vaccinate our homebound residents. So the clinics is just a piece of the things that we do. There's several other channels through which we are vaccinating people. Our FQHC, Federally Qualified Health Center, Health Partnership Clinic is vaccinating. Salvation Army is assisting and with efforts to vaccinate in our homeless population, as are the United Community Services, UCS, as are Heart to Heart, that's assisting in those things. So this is a broad coordinated effort that really, for me, typifies what a local public health system response is. There's not a single entity that can do it efficiently. And really, as you're beginning to see our numbers and the number of our residents that are getting vaccinated, I think you're beginning to see some of the results of that effort. And we're pretty happy about the directions that we're going. And I know Elizabeth will get into the numbers and just talk broadly where we are and talk about some of the efforts next week to give second doses in our childcare facilities, and then begin to venture into some of the questions we're getting today in terms of our schools reopening and the CDC's new recommendation. And then I'll come into add to that, Elizabeth.
Great. Thank you, Dr. Arreola. So we have seen a tremendous increase in the number of people who have been getting vaccinated, and that's in part because of some increases in our vaccine allocation. But again, as Dr. Arreola said, just a really broad approach to vaccinating our community members, using every single partner that we can to vaccinate vulnerable populations, people who are unable to come to our clinics, as well as having large vaccine clinics, both through the Department of Health and Environment and our hospital systems. And so with that, we've actually been able to vaccinate about 1 in 4 Johnson County residents with at least 1 dose, which is really incredible. So about 25%. And then if we really look at our 65 and up population, so that was one of our big phase 2 groups that we prioritized. We spent a lot of time working through. We're still trying to finish them up. we have been able to vaccinate just about 2 out of 3 individuals who are over the age of 65 in Johnson County. And about 1 in 3 of individuals over that age group are fully vaccinated. So have had both of their doses. And, we can really see the fruits of this labor because, we've seen our the number of deaths in Johnson County decline over time. And I was responding to a question today about, we saw some increases in hospitalization, around Christmas and New Year's, but we never saw that spike in deaths that usually would come after an increase in hospitalizations. And the reason for that is because of the vaccine predominantly. We've been able to vaccinate in our long-term care facilities, and by prioritizing those 80 and up individuals like we did at the beginning of phase 2, we've really been able to insulate a group of individuals who are really high risk for developing severe illness and unfortunately dying from this disease. So that is a huge piece of why we've seen this decline in deaths and a more modest decline in hospitalizations, because we know, there's still a large percentage of our population who has not been able to receive the vaccine. We're just now getting ready to open into phase 3 and 4, and we're seeing the effects of that. We are seeing individuals in that age group hospitalized and also dying. So we're working as hard as we can as soon as vaccine comes in our door, get it turned around to administer those vaccines either through our clinics or through our partners, because we know that the faster we can get these vaccines out, the faster we can protect our community members from really severe outcomes of this disease and improve the effects of these family members, right? Every person that we've lost to this disease has a family and creates ripples throughout the community of a life lost. And so that for us is a huge driving mission of being able to administer these vaccines as quickly as possible. Now, another group that we focused on in phase 2 is our K through 12 educators and our childcare providers. And we've been working with Children's Mercy, who has been a tremendous partner in this, since about the beginning of February to try and get every K through 12 educator who teaches in Johnson County and every licensed childcare provider or staff member to be vaccinated if they want it. And we have vaccinated over 15,000 individuals in that group, the K through 12 and the childcare. And we've been able to provide a vaccine for any one of those individuals who wanted it. And now we are completing our second dose clinics, and we have 6 second dose clinics between this tomorrow and the following Tuesday. And so really by April 1, we will have completed all of our K through 12 and childcare immunizations, which is a lot faster than we thought we'd be able to do. We figured we'd only be first doses by that time period. But because the governor allocated additional doses to us, because Dr. Arreola was able to divert some of those vaccines in order to prioritize our childcare providers, we've been able to move through very quickly, and that really supports our schools being open. As most of our schools are coming back from spring break and going full in person, this will really allow for continuity of education for the students, because we won't have to worry about quarantining teachers if they've been exposed, as long as they've been vaccinated. So that will be a huge help to both the schools as well as to the students and their families. So we're very excited about the progress. And I think I'll go ahead and wait before we talk about CDC's reopening or CDC's school guidance and finish talking about vaccinations, but we can talk about that in a little bit.
Right, and thank you for that. But actually, yeah, so one of the groups, and I do want to echo that, that has been very, very helpful and supportive, and who really their clients are not directly qualified to take the vaccines is Children's Mercy Hospital. They have been tremendously helpful, and they have assisted in the vaccinations. Again, like Elizabeth said, we were well ahead of the curve even before the governor prioritized vaccination. We were already close to vaccinating 40% of our group. So when the extra vaccine came, it allowed us to quickly go through that list. It is the reason why we're able to support our schools reopening in person. Secondly, understanding the risk, understanding that the need for masking and other efforts, ventilation, quick testing, quick public health intervention of isolation and quarantine, and cooperation of the school nursing and school administrative staff with our public health persons are very important. Earlier on, almost a year ago, we had began meeting with schools, having regular meetings. At one time, we brought in additional resources, and they're still there to help schools with contact tracing. We hired part-time staff and allocated them to the different school districts. We assigned one epidemiologist to each of the school districts, again, because of the focus. We were focused from the start to do all that we can to keep our schools open. And so when schools open in person fully, 6 foot distance is just not feasible. So that's not that's difficult. So we were pretty clear at the start that the lower the spread, the easier it is for schools to open. So once we were able to lower the community spread, and because of the staffing and other resources that we've pumped into the school, and because of the testing and vaccination that were ongoing, because also earlier on, which we don't talk about, is we prioritize vaccination of our school nurses as part of phase 1. So that allowed us to support, albeit with caution, our schools reopening in person. And we are continuing to monitor that, whether it's our friend, being able to be outdoor more is our friend, wearing mask is our friend. All of those are steps that are important to us being able to sustain this step. And so the new CDC guidelines that came out today, I personally have not had enough time to dig deep into, to dive deeper into it. Basically, is consistent with the reality of being in person. 3 foot distance is realistic, 6 foot is not, based on the way that our schools are structured. So again, there's a little bit of some measure of risk to it, but it is doable. It is doable if we test it enough, if we quickly identify cases, if we are able to isolate and quarantine appropriately. Those work, obviously masking work. But the fact that we have vaccinated staff, teachers, those are also huge advantages there too. So we'll continue to monitor that and maybe talk a little bit more about that guidelines once next week, once they're able to dive deeper into it. But again, to me, this 3 foot distance option is just the only realistic approach that you can have with schools being in person.
That was a whole lot of information. I don't think you guys even need me. That's a lot to take in, but I will go ahead and continue to ask some questions. So you did talk about how we're moving to phase 3 and 4 next week, and those are big groups. So we've gotten a lot of questions on social media and through email, phone calls, everything about how are we prioritizing those groups? Is it first come, first serve when they fill out the interest survey, or do you want to talk about that?
Yeah, thank you, Theresa. I know that I'll let Elizabeth come in and talk about some additional. There are multiple considerations that we typically have. Obviously, you have to qualify for the phases. We still have some in phase 2 that we still need to finish. 65 plus continue to be our priority. We did a poll this past week, and we were able to identify a few thousand persons in that group that said they're yet to be vaccinated. By the way, the appointments that we opened up last week, we send those out to this group. Now, we are pretty clear that the link is circulating around the county. And so later we're going to be able to understand how many of these people actually were able to get the appointment. And so there are people in phase 2 that are qualified for the appointment. There are people in phase 3 and 4 that qualify for the appointment. And like I was trying to describe, we're going to continue to have targeted opportunities for groups to be vaccinated. Clearly, one group that we want to finish is the 65 plus, and so we are thinking through how to ensure that appointments that we book for, that we make available for them, are truly available for them. So thus far, there's been challenges. People want to take the vaccine. That's just where we are. And while we are trying to make the appointments available to people that qualify, and do targeted vaccination as we deem necessary, we understand that. So if you are qualified and you book an appointment, we tend to err on the side of just vaccinate you and move on. But we do need to finish our 65 plus category. We absolutely have to, but we're thinking through how to have targeted, well, not just for the 65 plus, for the remaining persons that are grocery store workers or remaining persons in our restaurant workers. But like I was saying before, we also have we are engaging all of our utility companies, water, Evergy, and all of them, getting a feel for the number of employees that they have, and working them into our clinics as we have opportunities to. We are continuing to engage our partners. We are in conversation with a few of our pharmacies that we feel can assist with some of these targeted vaccinations, because again, there's just so much appointments that you can have in a clinic, and so we need to be able to do all of these things simultaneously. We're looking forward to being able to share even more detailed information about this next week. Bottom line is, between now and the end of April, if you are in phase 2, 3, and 4, you qualify for vaccination. Our job is as expected, based on what the governor said, Governor Kelly. We're expecting more doses of the vaccine. Our job is to make sure that we are giving out those doses as we receive them. We are not one of the, basically our goal is to give the vaccines out, and we're working on ways to give those out as quickly as we can. And so again, patience is the key word. If you qualify and you've not been called, it's not because you are not on the list. If you're on our list, that's one way that we look at it. But even within our list, there are other considerations. We are looking at equity considerations, just like we are looking at people that are have pre-existing conditions that will predispose them to some of the adverse consequences. We're also looking at the fact that vaccination opportunities have not been pretty high in our minority populations, Black, Indian, and people of color, Latinos population. So we're going to do some targeted vaccination in those categories. And as we are pulling from our list, those are some equities what we're looking at. That's why we're engaging some of our partners to do targeted vaccinations in our minority communities. But just like, again, we've done with 65 plus, which is another form of equity, or in our intellectual and developmental disability, which is another form of equity. So racial equity is also a consideration here for us as we make decisions on appointments.
So on that topic, we're getting some questions on social media about showing proof. So that might have been easier with those early phases because you could look at a driver's license or something like that. Now we're talking about specific employers, and we're also talking about health conditions. So do people need to bring like a doctor's note or anything like that?
Your turn, Elizabeth.
Thanks, Dr. Arriola. So we recognize that people have a number of health conditions and may or may not have access to a physician currently. So there's also an equity piece there. If you maybe are currently uninsured or don't have a physician, you maybe can't get a note saying that you have a pre-existing. And also, unfortunately, there's also a lot of opportunities for fraud in this. It's probably pretty easy for somebody to go on and create a fake doctor's note saying I have X disease. So we are going to trust that individuals are being truthful about their conditions. And in terms of the pre-existing conditions, so those high-risk conditions and moderate risk conditions, as KDHE has set them out, we will not be requiring proof of any kind of past medical history. Now, if you are not a Johnson County resident, but say you work in a Johnson County facility, that's one of our critical infrastructure pieces or sector that's included, we will ask that you bring some proof of employment that you are actually employed in Johnson County, or a driver's license saying that you are a Johnson County resident. And this is really just to be able to try and prioritize our vaccine for people who are living and working here in our community. We understand that there are vaccines that are available in more rural parts of Kansas and other places, but we really want to focus on our own residents or people who interact with our residents on a daily basis. So while there will be some ask for proof of employment or proof of residency, in terms of pre-existing medical conditions, we will not be asking for proof of that. But again, I will implore you that there's a reason why these individuals and these conditions are prioritized above the general population. These individuals are at an increased risk for severe outcomes. They are at an increased risk for hospitalization and death. And we really need to do this. We have done a tremendous job of being a community during this pandemic and coming together and doing all the things that public health has asked you to do with masking and not gathering. This is one more of those pieces. we really need to be in this as a community and recognize that there are individuals who really do need the vaccine and really should be at the front of the line. And so we will ask that you please respect the phases and not sign up if you are not actually eligible. So that's my plea for community here.
Yeah, and just to add to that, we're basically saying we don't need you to come into the clinics with your medical records or your medication or anything. We don't need any of that. We don't want to see those. If anything, we want proof that you are a resident of the county, and like or you work here. And like Elizabeth said, respect the process. We have some people that are at higher risk of more serious conditions, and those are the ones that we're prioritizing. Very soon, very, very soon, sooner than you and I thought a couple of weeks ago, this vaccine will be available to everyone that wants it.
All right, great information there. Another important question that we're starting to talk about is, at what point are you fully vaccinated? So if you have 2 doses, how much coverage do you have essentially after that first one? And then where are you with full coverage? And then also, why is it important to continue safety precautions even after you're fully vaccinated?
Yeah, thank you. So to be clear, if you take Johnson & Johnson, it is 1 dose. And typically you have quote unquote full immunity 28 days after the shot. Now for both Pfizer and Moderna vaccine, it's assumed that you have, based on data, not assumed, based on data, that you have full immunity 2 weeks after your second dose. Now, you do have some immunity that begins after your first dose, but your full immunity happens after 2 weeks after your second dose. To be clear, even with those, you need to wear a mask. It's not, I mean, getting 2 vaccines and being 2 weeks after that is not a license to do things like you want. We have seen people that are fully vaccinated, that are 2 weeks removed from their vaccination, still get infected through what we call breakthrough infection. It is low. These vaccines are 100% effective in preventing death and hospitalization, but it's not 100% effective in preventing severe or milder illnesses. And there's still a proportion, even though it's 95% effective in the 2 of them, Moderna and Pfizer, there's still 5% of the population is still pretty large. So there are some that the kind of immune response that we want is not what we get. There's also still this remaining question of even though you are immune, or that you can still contact the virus or still be able to infect other people. And so those things are there's research going on. There's no question that even with the vaccination, that the level of virus that you're able to spread does get reduced. But those things are still there. That's why everyone should still wear a mask. And also keep in mind that the vaccine is available for people that are 16 plus. Hopefully in the future it's approved for a younger population, but right now it is not. So we're not going to be able to vaccinate every member of our population. There's still going to be some people that are not vaccinated. There's unfortunately some that will choose not to take the vaccine. And so, so the battle is now won with vaccination. Yeah, we do have a leg up, but keeping all of those steps, wearing masks, physically distancing, is especially more important now. Now, when we begin to get to where we have vaccinated 50, 60% of our population, then we might be able to take a few steps back. But, you know, CDC is allowing us to do a few more things, can interact with others that are vaccinated. So these are not just going to be an on or off switch. It's more like a dimmer. We're just going to take baby steps at a time and see how it works, and then take another step.
Yeah, and just to follow up on Dr. Ariola's statement, he's absolutely right. The vaccine is highly effective, but there are some caveats to that, including the variants as well. Moderna and Pfizer were not tested during the time that the variants that you've heard a lot about, the UK variant, for instance, were circulating throughout the world. And so we're not real sure about how effective that is for these variants. And we know that J&J has some reduced efficacy when it comes to these variants. And so it's really important that once you are vaccinated and fully immune, so particularly Pfizer and Moderna, 2 weeks after that second dose or 28 days after the Johnson & Johnson, you can start taking some reasonable steps. But to Dr. Ariola's point, it's not time to go to the grocery store, or the mall, or to a big party or a concert or anything unmasked. You can gather with other individuals who are vaccinated and be unmasked. But if you're going to gather with somebody who isn't vaccinated and you are, then you want to be very cautious. If they live with somebody who's high risk or they themselves are high risk, you probably want to hold off or stay masked that whole time. And definitely not with people from a number of different households. You don't want to be getting together with, unvaccinated individuals from, 6 different households, because then it really does have potential to spread. And that is still our goal. We need to keep that spread low, particularly with the variants circulating. I think CDC came out today and said 30% or Dr. Fauci said 30% of all viruses in the US right now are these variants. And so we need to just still be a little cautious. But if you are vaccinated and have some vaccinated friends, certainly you can get together. Outside is always better. The weather is starting to get nice. So just use reason. It is not time to go crazy and wild and have those big parties, but there are steps, like Dr. Ariola said, it's a dimmer switch. We can start taking some steps once you are fully vaccinated. And as we get through the next several months and we can get the majority of our population vaccinated, we will continue to see some of those become more permissible and be something that we can do safely.
All right. Again, great information today. And I think we'll go ahead and wrap it up there. Thank you all for watching. And of course, thank you for providing great information to our viewers. We'll see you all on Monday.